if we move more towards the detection systems, because AI systems are only as good as the data that you put into them. What are the measures that can be taken? I know you've worked with functional MRIs that are quite on the rise and are very trendy these days. The MRIs. What means measures could be taken to improve the data that is fed to the AI so that it can better detect these cases?
Yeah, so I mean, when it comes to the method of detecting breast cancer, mammography is the one that is the most proven. There have been many randomized studies showing that it's of value. Other common methods that we use like every day in the department at Karolinska is ultrasound and MRI, magnetic resonance imaging. Ultrasound is very convenient. You need just a normal office room. Basically, there is no radiation, no, just like ultrasound, and you sit with the patient. You hold the probe in your hand. It's easy to take samples if you see something suspicious and so on. But it also takes a lot of time for the radiologist because you actually have to be there all the time during the whole examination and perform it. But it has a different type of contrast because it's ultrasound compared to X-ray. So when you have this kind of dense tissue, it's hard to see the contrast between the tumor and the dense tissue on the X-ray, but on ultrasound, it's quite often easier. You get more, there's more of a different contrast. So the tumor is like quite has low echogenicity, means that it looks dark on the image, basically. There's not so many changes in the sound transmission, so that there is not a lot of reflection in the tumor. And we use it a lot, but we don't use it for screening. And also with MRI, we use it a little bit less because it's more expensive, takes a little bit more time, and there are some contraindications. But we use it when we feel that mammography and ultrasound does not maybe tell us the whole truth. So when we need to see more accurate, where is the tumor? Could it be slightly larger? Could it actually be more kind of manifestations in the breast? It's not always that it's just in one place. There could be another one. It could be several foci of tumors in one breast, and there could be in the other breast. That's an increased risk for the other breast when you have cancer in one. When it comes to screening, there have been attempts to use, and in some countries they use more ultrasound also for screening. I think some countries where it's more like maybe more available, but also where in general the women have more dense breast, like they have less like fat in the breast, so mammography is a little bit less valuable. Then ultrasound might become a better option. So that could be, but the best is probably, the best relatively common method is MRI, contrast enhanced MRI. So you inject a contrast agent and then you perform an exam, and it might take 10-15 minutes if it's not a very extensive protocol. It's been shown to be definitely the most sensitive of these three methods. So that's something, but it's also it is time consuming. It requires quite expensive equipment, and there's not that many trained staff as for other types of like X-ray examinations. So it would be very difficult or practically impossible to offer it to everybody. So I think the most reasonable thing would be to, as we are also trying now that we have developed with the group here at KTH, something like AI algorithms that can help us make the decision when mammography is not sufficient for a specific individual, based on the appearance of the mammogram, to decide that for this woman it is more important to add an MRI or suggest an MRI exam. And that's also an ongoing study, but we only have like preliminary results so far. but it's very, very promising. It's like it's more, we find more cancer than we had kind of thought or imagined that we would. So
it's a system of levels, basically, that if you qualify, it's not necessarily qualification as some sort of
in a way. Yeah. So it's and of course there is no clear limit that you have to be above in this our scoring system. So it's a trade-off between available resources and how many women do you want to recall without cause to find one cancer and so on. So that's the usual trade-off. And I guess there will also be some health economics aspects when this will be considered to be implemented in routine practice. And I think our results right now are so good that I think that should be done. But we have to finish the study and write it up and do all the analysis, of course. But it looks very promising.